Good morning, everyone. I'd like to welcome you to NB Lung's 31st Annual Respiratory Health Symposium. Next, we're going to be hearing from Dan Coulombe. He's a pharmacist and the Executive Director of Pharmaceutical Services at the New Brunswick Department of Health, which is responsible for the management of the province's publicly funded New Brunswick drug plans. Prior to his current role, Mr. Coulombe held positions as Executive Director of the Acute Care Branch and Executive Director of the New Brunswick Cancer Network at the NB Department of Health. His background also includes work within the hospital system in the province, as well as community pharmacy practice. This morning, Dan is going to talk to us about the NB drug plan and support for uninsured New Brunswickers. Thank you for joining us today, Dan.
Good morning. Good morning, everybody. Thank you to NB Lung for the opportunity to speak with you this morning and to provide a bit of information about the New Brunswick drug plan. Very informative presentation by Melanie, and certainly with the background I had at the New Brunswick Cancer Network, very topical subject. So we had tried to get myself doing the moving of the slides, but I didn't have confidence that it was going to happen. We couldn't quite get it the way we'd want to have it presented. So I'll have the folks at the NB Lung do the actual turning of the slides. So topic today is our, as Sarah mentioned, the New Brunswick drug plan. So we can move to the next slide, please. So before we get into that, I just wanted to give a bit of an overview of what drug coverage options are available in New Brunswick. And then I'll talk specifically about the topic of today, which is the NB drug plan. So anybody living in New Brunswick has options. There's private drug plans that an individual can sign up to. A number of insurance companies provide health benefit plans, which includes drugs. So we've highlighted Medavie Blue Cross as an example of one of the large ones, Sun Life, and there's others. There's many others. So any individual in the province can get access to a drug plan and a health benefit plan through the insurance company side. There's also employer-sponsored drug plans. So myself, for instance, employee of the government of New Brunswick, we have a plan, a health benefits plan, which is co-sponsored by the individual and the employer. And in our case, it's Medavie Blue Cross is the carrier of the insurance. It's the insurance company, so they're the carrier of the plan, which includes drug coverage. I think the federal government, employees of the federal government that may live in New Brunswick have access. And I think their plan is administered through Sun Life. There's also residents of the province who are covered by federal government sponsored drug plans. So if you happen to have worked for the federal government or do work for the federal government, you have access to a plan. If you're a retiree of the federal government, you could have access to a retiree plan that would include drug coverage. If you're a veteran, Veterans Affairs Canada, they have a plan that's available for veterans. People that live in New Brunswick who are employed by the Canadian Armed Forces have an access to a federal plan, RCMP, non-NIHB or non-insured health benefits for First Nations and Inuit. So those individuals living in New Brunswick have access to a plan as well through the federal government sponsored drug plans. Next slide, please. So in the province, we have some what we call provincial government-sponsored drug plans, and there's two big buckets for that. One of them is the one that we've had for years, the New Brunswick Prescription Drug Program, and the largest number of clientele in that under that drug plan, NBPDP as we call it, are the low-income seniors. So those are seniors who have guaranteed income supplement. There's also clients of the Department of Social Development that could have access to the NBPDP plans. And that includes children in care of the Minister of Social Development and adults of residential adults in residential facilities, or ARFs as we call them. Residents of nursing homes can get access to the NBPDP drug plan. And there's also some disease-specific plans. So areas like diseases such as multiple sclerosis, cystic fibrosis, HIV/AIDS, recipients of organ transplants, persons with growth hormone. So these are medical condition specific plans under the NBPDP that are also part of our plan. We also have been more recently, in the last couple of years, inmates of the provincial institutions, correctional institutions. That drug plan aspect has come over to the Department of Health, and we now have a plan for correctional services for inmates of our provincial institutions. And then the main topic of hand today, which is the New Brunswick drug plan, which was brought in to give access to drug coverage for uninsured New Brunswickers. Next slide, please. So what's the NB drug plan? So the NB drug plan was introduced in 2014. It was there to support residents of New Brunswick that have no drug coverage. And at the time, we were hearing upwards of 30% of New Brunswick have no access to a drug plan. So how do you qualify for the NB drug plan? It's fairly straightforward. Any New Brunswicker with an active Medicare card and no other drug coverage, they can get access to the NB drug plan. It's also available for individuals that do have a drug plan, but have either their plan doesn't cover a drug that's listed on the New Brunswick drug plan's formulary, or in some cases, some private drug plans will have yearly maximums or lifetime maximums for drug coverage that the individual would have reached, and if they demonstrate that through enrollment that they have a plan but they can't get access to a specific drug, then they can get access to the NB drug plan. One of the advantages of the NB drug plan versus other private drug plans is that there's no restriction on pre-existing medical conditions. So a lot of private health plans, that's part of the enrollment process. If you're excluded, typically you're excluded if you have a medical condition and the drugs that cover that medical condition at the time of application. That's not the case for the NB drug plan. And how it works, it's an income tested plan, in that there's 21 income levels and ranges, and I'll show that in the next slide. But depending on the income of the individual applying, that will determine what premiums they would pay and what copays they would pay per prescription. And we have there's about 18,000 members right now in the NB drug plan, and all totaled between the NB prescription drug plan and the NB drug plan, we call it our NB drug plan. So under the entire basket of what's the NB government sponsored drug plans, we got about 130,000 individuals. So that's only about 17% of the New Brunswick population is covered by by our government sponsored drug plans and programs. Next slide, please. So this just gives you an appreciation for, based on the income, what someone's monthly or annual premium is and what their copay. And all of the copay levels, and so that's per prescription, it's 30% copay to a maximum per prescription. So, if an individual is making $18,307 or less, their monthly premium would be $505. Their annual premium is $65, and they'll pay $4 a prescription. At the high end, so anybody making over $89,000 or $152,000 family, their monthlies are $221, and their premiums would be $33.05. So that just gives you an appreciation for that's current. Now, every year we have a review of the drug plan and the income ranges. We want to make sure that the ranges and the premiums are appropriate. And so every year there may be an adjustment. This year there will be an adjustment come November 1st, and I'll show you that in a few minutes. But this is what the current income levels, premiums, and copays are. Next slide, please. So how do we enroll? Again, it's fairly straightforward. All of the information regarding all of our drug plans is on our public website, is on the government-funded Government of New Brunswick website under drug plans, and I'll give you an appreciation for that in a second. The application form and process and frequent FAQs, frequently asked questions, are all in there as well. The application form is fairly straightforward, and once the applicant is enrolled, their coverage starts the first day of the following month. So as far as prescriptions, the question was asked, do they have to go to certain provider pharmacies? The answer is no. Any of the pharmacies in New Brunswick, and we've got 700 and some pharmacies in New Brunswick that are provider pharmacies that are registered with our NB drug plans. So the prescriptions for the NB drug plan can be filled at any provider pharmacy in New Brunswick. And when they do that, the prescription costs are billed online to the NB drug plan, and the patient, if there's a copay, they pay is the copay at the pharmacy. Next slide, please. So what does the NB drug plan cover? It only covers drugs. So things like vaccines and medical devices, other supplies and equipment. So things like CPAP machines, continuous glucose monitors, they're not part of the drug plan. This is just a drug plan. It covers drugs. Our formulary is available online and searchable. So again, on our website, most of the drugs on the formulary, which cover the array of medical conditions that typically affect citizens of our province, most of the drugs are regular benefits, which means there's no criteria, there's no prior approval requirements. There are some drugs, however, that because they might have specific criteria for use, that they are there, they have special authorization. So that is common, and our prescribers understand that process. They've got to submit a special authorization request to the drug plan, which would be the proof that their patient meets the criteria that are indicated against that drug. And then if the special authorization is approved, notification goes back to the prescriber and the patient that the drug is a benefit, and they can start getting prescriptions for it. Next slide, please. This just gives you an appreciation for what the drug approval and review process is in Canada. So when a pharmaceutical company approaches Health Canada they've got a new drug and they want it approved for use in Canada, they submit that to Health Canada. Health Canada will look at it really from a safety and efficacy and quality perspective. And then if it meets those requirements, it's approved for use in Canada. After that, it then goes in the public space. So our drug programs, the government-sponsored drug programs, and that's the case in every province. It goes through a review, which is done by, and now it's called the Canada's Drug Agency, formerly called CADTH. So that was CADTH. It was the Canadian Agency for Drugs and Technologies in Health. So last year they had a name change. They're called Canada's Drug Agencies, or CDA. They do the review. It's called a common drug review. They have expert committees that will review drugs both for oncology and for non-oncology. So non-oncology is called the PCODR, PCODR, the Pan-Canadian Oncology Drug Review. So under the umbrella of formerly CADTH, or Canada's Drug Agency, they'll review drugs on behalf of the governments across the country. And out of that, they'll come up with their assessment, their evaluation. And if the drug has been proven against the clinical evidence that's been submitted to them, if it's proven to be better than what's already on Canadian public formularies, then it gets a positive recommendation. At that point, I guess to finalize that, Quebec has their own review, and but just basically for completeness sake, in Canada, I just wanted to highlight that Quebec also they do their own review. From that, it then goes, if there's a positive recommendation, there's another organization in Canada called the Pan-Canadian Pharmaceutical Alliance, which will enter into negotiations with a drug manufacturer to get the best possible deal for the publicly funded drug programs. So once that happened, then each jurisdiction will get into what's called a product listing agreement with the manufacturer, and then the drug gets listed on formularies. So this is just a broad overview of how the drug approval and review process occurs for the publicly funded drug programs. Next slide, please. There's also a Health Canada run programs called SAP, or Special Access Program. So that it's mainly for drugs that are not available for sale in Canada. So either they're still under clinical trials, however, they're proving to be of benefit for patients that have serious or life-threatening conditions, and those can be available to patients through this SAP. Sometimes, in some cases, the special authorization or special access program drugs are covered by the manufacturer free of charge. That's not always the case, but essentially that is a program that's available through Health Canada to allow patients to get access to drugs that are in clinical trial but are showing promise that they have benefit to various conditions. SAP drugs, however, are not covered by the New Brunswick drug plans. We will only cover drugs once they've gone through the process that I mentioned on the previous slide. So they have to be approved for use in Canada, and then have gone through the review by CDA and the Pan-Canadian Pharmaceutical Alliance. So SAP drugs are not covered on our plans. Next slide, please. So hopefully, if the links work, this just gives you where the information can be obtained and seen. So we have a website that has the application form, as I mentioned previously. It's got the link to our NB Drug Plans formulary. It also has frequently asked questions. So we have an information line, a 1-855 number that's available Monday to Friday. And there's also a website or an email address that people can go to that links it straight through to the NB Drug Plans. So again, as mentioned at the outset, our plan administrator for our NB Drug Plans is Medavie Blue Cross. So they do the day-to-day adjudication of drug claims. They do any of the application process and questions that could come to the program. That's all part and parcel of what the service provided by Medavie, which is under contract with the Department of Health for that service. So maybe if you can, if it will work, we can click on the top link and just see if that takes us to the website. Okay, so that gives you that's what you see. This one's the NB Drug Plan, but that's part of this one just brought us right to the drug plan. But if one goes back, you can the top line will say under drug plans, the one on the top right, that'll take you to the front page of this. But this gives you an appreciation for the NB Drug. Yeah, so there's the NB Drug Plans, and that covers a lot of information, as I previously mentioned. So the New Brunswick Prescription Drug Program information is in there. There's all kinds of information on this and the other, the one that we were just previously on. So if you can scroll down to see the NB Drug Plan on the bottom, and that gives you, if you click on that, it'll take us back to the page that we were at previously. And then you get the enrollment in the plan, the premiums and co-payments. So if you want to click on premiums and co-payments, That's already on our website. So this is, as I mentioned, the effective, the currently affect gross income levels, premiums, copays. There's where we are now. And if you scroll down, you'll see what's going to take effect on November the 1st. So not a big adjustment, but the main reason for the adjustment was that wages have gone up in New Brunswick fairly, it outpaced the CPI. So we had to make an adjustment so that most people in New Brunswick that are currently on the drug plans will stay within their own um, range. So we've had to make an adjustment on the income ranges. So, but this is what's going to take effect November 1st. These will be the new income ranges. And maybe one more, if you want to back up one more, and I'll just give you an appreciation for the formulary is in there as well. So you click on your Brunswick Drug Plan formulary, which is, there you go. And then if you click on the PDF version, all right, so that's the formulary. Up in the top right where you see the search feature, if you go up and click on that, up right there, you can enter a drug name, any kind of drug, whatever. So someone's searching for, well, what's the status of a certain drug? Is it covered? You can type in a drug name in that field, and it'll take you right to where it is in the formulary. So that's just a demonstration of what information is publicly available on the government of GNB, Government of Brunswick website under NB drug plans. So it covers the NB drug plan, but also all the other drug plans that are under our umbrella. And I think with that's the end of this presentation. So I guess available for any questions.
Thank you, Dan. Currently, I don't see any questions there, but maybe they'll pop up in just a moment. That was great information, and it is very overwhelming for someone when they're sick or having to go through this. So just so people know, often the hospital social workers will help people go through these forms and apply for the programs because maybe they're not aware of them.
Yeah.
So that's really helpful. And I know that having been into pharmacies, that often the pharmacist will mention it to people too. So that's a great service. Yes, absolutely.
Yeah. And that 1-855 number, the number that we direct people there all the time. That's what they do. They have customer service representatives that will field questions about any of the programs that I mentioned previously. And then they help individuals. The actual NB drug plan is a fairly simple application process. There's really nothing very cumbersome about it. So, but for individuals who need assistance with it, it's there's people at the ready to help.
Great. Thank you so much for sharing that with us today. I'm not seeing any questions right now. I think you must have really covered it very concisely. So thank you very much for your time and for being with us today. Yeah, thank you.